got cited for not doing enough training. So we're going to review everything that we're doing here. Okay, so please understand that we have 2 carts set up in the nurses station, okay, in the office area here. And they're for the immediate use if anybody becomes symptomatic, okay? And that doesn't mean that they have it, but if they have an upper respiratory infection, we're gonna treat everybody, okay? So please contact the delegating nurse if they're not on duty to make sure they're aware of the situation. And then the delegating nurse will notify me. Linda Scott has access to extra supplies. So we have 2 carts in here, we have 4 carts set up in storage. And then we have, excuse my French, we have a shitload of supplies in this building. Okay, we have a ton of supplies. The only thing I'm having problems with is face shields. And I've ordered them from like 5 different places, and they keep telling me they're on their way, they're on their way, they're on their way, and they're not. So I just contacted a local company to ask them if they get them in, because I'm gonna contact them. But I've spent like, I bet $700 so far on face shields that nothing has come in. I do have 2 face shields in the building that the health department gave me, so that if something happens that we do have an active case, we can use them. But we'll go over what those are, what supplies, you know, what you would use those for. And you would only use a shield if the delegating nurse tells you to use a shield, okay? So symptoms of the COVID-19, and I've told the nurses to interject anytime they feel they have to add something. Symptoms of the COVID-19 are a temperature over 100.4. Okay, I want the delegating nurse to be notified if anybody, staff or residents, have a temperature over 99. You agree? So we should be aware that they have a temperature over 99. Most of the time when somebody has a temperature over 99, you wait about half an hour and take it again. But they just weren't overheated for some reason. They have a cough, they have shortness of breath, and chest tightness. Okay? But so notify the delegating nurse on call as soon as somebody has an elevated temp. Okay? The resident, even if we have no testing to see that they were positive for COVID-19, the resident is immediately isolated in their room. Okay? And then we'll start using protective equipment. Okay? So the doors to be kept closed at all time. I'm making signs today that we'll put in the drawers that in the type that you put on the door that this is an isolation room, and keep the door closed. Okay? Place a blue surgical mask on the resident when you're giving them care. They don't have to wear it when you're not giving them care. When they're in the room by themselves, they're okay. But if you're giving them care, put a blue surgical mask on them. The staff entering the room should take off their cloth mask and put on a blue surgical mask. They're in the drawers, okay? Now, please understand, we're gonna limit the people that go into that room, okay? So, Robert, you would have no reason to ever go in the room. Housekeeping would at one point, probably once a week, but everything that's in that room to be thrown away is gonna be thrown away in a red bag. So, you know, we're gonna minimize the amount of people going in. When staff is entering the room, take off your cloth mask and put on a blue surgical mask. Wear protective clothing. And Courtney's gonna show you how to put a gown on and take a gown off. Gowns are not reusable, they're disposable. We have paper gowns, we have plastic gowns. It doesn't matter which one you wear. It doesn't matter which one you wear. That's paper. So you wanna show them how to do it?
All right, sure.
Taking it off is the trick.
Yeah, so it'll be in the drawer on the outside of the room before you go in. So you'll unfold it, put it on first. All right, it has a tie around the waist. I'll just tie it so I don't rip it a little bit. And then there's strings to go behind your neck also. Sorry, we got stuck. So you would tie it all the way. I'm not going to tie it all the way. And then you would put your gloves on next, and you'll put your gloves on so that they cover the wristbands.
Hair,
Oh,
head, cover head.
all right. Put your hair net on. Put your, I guess I'm getting all my dress here. I would put my blue surgical mask on. I would put my goggles on. And a face shield if we
have somebody who has it.
I mean, yeah, this is pretty
This
good
is very
protection,
protective here.
Okay, and then last I'd put my gloves on and you would cover the cuffs of your sleeves. Go in, do whatever you have to do. So the caps are disposable as well. Take it off, throw it away in the red trash bag. Your gown, so your gloves, when you take your gloves off, you take your 2 fingers, put it on the inside of the glove, and then pull it off. And then you're going to take your other finger on the other side, pull it off. You don't want to touch the outside of the glove because that's where it's contaminated, and it'll be inside out in the ball. Throw it away. The gown. All right, untie your back string. And these goggles are up.
Yeah, they steam up, right?
All right, untie your top string. So with the gown, obviously the front is contaminated. You don't have your gloves on, so you want to be sure that you're not touching the front of the gown. So you'll untie your strings from the back, and then you'll just kind of lean forward and kind of do a shimmy. So you can touch the inside because that's not where it's contaminated. So I would just grab it like this. Grab it like that, and then ball it up so it's inside out, and you put it in the ball and put it in the red trash and leave the room immediately, and then you want to wash your hands.
Yeah.
So you'll have to go to the nearest sink, do proper hand washing, 20 seconds, warm soapy water, and you're done. Questions?
I have a question. You don't have to wear like the foot covers?
No.
The shoe cover?
No.
No, okay.
You know, you should cover it, yeah. Okay? Okay, so you know you're supposed to, when you use gloves, the proper use of gloves is wash your hands before you put the gloves on. Because you know, we've talked about this before, you have bacteria on your hands. And so, you know, wash your hands so that you knock down the amount of bacteria that's on, because if you have the smallest amount of bacteria on your hand and you have a little opening, that bacteria is growing underneath those gloves. And if it finds something, you know, some way to get in your body, it might not be the COVID vaccine, virus, but it could be anything. So, you know, make sure you wash your hands before you put them on. So the equipment is only to be used by the people that are going in that room doing care. Okay, and what we're going to do, if we do have somebody who we are suspicious of, then one person is going to be the caregiver for just the resident that's symptomatic. Okay, so, you know, you're really protected. You don't have to worry about picking it up because you've got everything covered. But we don't want you to have something on your clothing or something, or you miss something, and so one person will be assigned to that room, and that will be their daily assignment for the rest of the time. You know, knock on wood, let's hope, you know, nothing ever comes up. So, you know, please understand, housekeeping, everything, nobody goes in that room with an isolation sign on the door without permission of the delegating nurse or myself. Okay, so you just stay out of it. Don't think you're being brave and you're going to be helpful. You know, this is kind of like the old days, 100 years ago. You know, please understand, I've been doing this for 50 years. You know, staph infections used to be the thing that everybody was so concerned about. You know, and people would stand outside rooms crying because they were. Now it's like, oh, it's only a staph infection. You know, they're not so worried about it. So there are large red bags in the drawer, and that's for isolation for disposal of trash. Okay, so you put a bag at the door of the room inside, not outside, because somebody like Grit can go through the bag. You know, so you want it inside, and all the trash, meal trash, clothing trash, everything. for the 3 shifts. You'll be okay, that bag will hold everything for 3 shifts. At the end of the day shift, we'll get rid of it. And it goes to the isolation, the hazardous waste back there. So we'll do that on the day shift so we can get to it, okay? And the outside of that bag is not, it's not contaminated. Would you put it in another bag inside? So we should put bags on the outside of the room. And then when you bring the red bag out, put it in a clear bag. Okay, so we need clear bags in the drawers.
Like the bigger ones.
Yeah, the ones that we use for the big stuff, okay? Isolation signs, so the delegating nurses should be notified if any, notify the affected resident's family of the condition. And then I'll take it upon myself to call everybody else's family in the building, because they want to know if something happens, if something pops up, okay? Now, the eye protection that Courtney put on, these are reusable. So once you've been given a pair of these, you wash them with soap and water and you keep them. This will be yours to reuse. Okay, I have 50 pairs of these in the building. And so you would reuse these. You just wash them with soap and water. They're very hard plastic. There's some other masks over there that the delegating nurses will hand out as they feel they need to. So the shields are also reusable. Okay, so if you ever get a shield to use, again, you wash it with soap and water, and then that becomes yours. Some of them have a band on them where you can write your name on it, okay? But you would reuse that over and over and over again. My God, I'm really trying my damnedest to get them in the building. I asked Linda, we've contacted everybody for weeks and weeks already. Okay, entry into the building, you all understand the entry into the building. No one's allowed to enter the facility except employees of the Hermitage. Contractors with my permission, because we have to maintain the building. You know, the people who were here 2 weeks ago for the fire thing, we have to maintain the fire system. If we don't, and the building burns down, we're in trouble. But we still do testing on them. We take their temperature, we have them fill out the questionnaire, and they have no patient contact. You know, they're doing, Ivy's doing, with the help of the delegating nurses, Ivy's doing conferences with doctors for residents, you know, so we're doing everything as distant as we can. And then there might be some people that I have to let in the building to do some other things, but nobody comes in without my permission. Anyone entering the building must come to the desk, fill out the questionnaire, and have their temperature taken by another staff member. Okay, nobody else can take their temperature themselves. Okay, you have to have somebody else. And when you do the questionnaire, put your temperature in that little square over there that has all the questions in it, because every day I go through the whole pile. And if it's up here, because I sit there and go through this, I read the name, I read the temperature, then I have to go through. It's just kind of a pain. For me? Okay, Sarah and Courtney are going to review the hand washing procedure and proper use of hand sanitizer. There's a paper on here again, how to wash your hands. You know, I read a thing over the weekend that it said, really think about it, stop and wash your hands every 20 minutes. You know, if you're not doing patient care and you're washing your hands after patient care, housekeeping, dietary, stop and wash your hands every 20 minutes. Okay? It's just better to wash your hands. The medical director will be notified by the delegating nurse immediately if we have any suspicion. I'll notify the Maryland Department of Health immediately. They've given me numbers to contact them 24/7. And if a resident is critical in unstable conditions, the nurse or the appointed staff will call 911. And the nurse will report that it's a COVID-19 risk of exposure to the dispatcher. So at that point, they would send them to the emergency room. Okay? Now, may I share, Monica? So Monica had a situation where her significant other ran a temperature over the weekend, and so she was concerned. And they took him to the hospital, and they tested him, he was COVID negative, but you know, the damn flu's out there too. You know, he has the flu. So, but she came and told me. So, I mean, that's good that you tell, so that we know what's going on with each personal. Maxine's in the hospital from the dietary department. It's her blood pressure. You know, so. Hand washing. Do we need to go over hand washing with you? Hand washing. Wet your hands, apply the soap, wash for 20 seconds, sing happy birthday. You know, rinse well, dry your hands, turn off the tap with the paper towel and open the door with a paper towel. So a dry paper towel, because viruses transfer through wet. Okay, so use dry. Okay, questions any of you have? Yes, Brenda. Okay.
Can't they take each other's?
Take your temp. Do you know how to?
Yeah.
Take your temp and then come back later and have somebody else take it.
Okay.
Okay? Is that, do you think that's okay? Yeah, huh? It doesn't matter.
Well,
Doesn't
it's
matter.
probably gonna be different as
Yeah,
long
it
as
does.
it's
I mean, if
normal.
you take it 3 seconds later, it's sometimes like a tenth of a degree. Huh? Write them both down.
Write both down? Okay.
Yeah, write them both. Yes. No, you are not. The person who, you would not go in, only the people that the 3 of us decide can be in, but you definitely would not, no, deliver a tray. No, the caregiver would. You just want to keep it down as minimal as possible. But we don't go from patient to patient either. Okay? We don't go, so the person who's giving care doesn't go to somebody else. They might just have to sit their butt in a chair outside the door all day. You know, that's what they might have to do. Questions?
They only do one person if you have.
Well, if
Yeah,
we only have
yeah.
one person who's suspicious, they would only do one person. You're absolutely right. Just because you don't want it to go, you don't want it to spread, yeah. Questions? Sarah, Courtney, you have anything else to? What?
If you do have someone, do their laundry still get done there?
No, well, let us worry about that. Leave their laundry in their room for them. Okay? I don't even know if I would send it out of the building.
Right.
You know, you know what I would tell you we would do? We put gowns on them and let them stay in their room in gowns. You know, don't you think?
Yeah.
Wouldn't wear clothing.
Because we can wash it in our washing machine
No.
and then that's
No.
gonna be, yeah.
No,
Even though we wash it in a hot water.
no, it's not hot enough.
Yeah.
It's not hot enough, yeah. That's a good question. Good question.
It's been a night back for how long?
Whatever, yeah, whatever, yeah.
Yeah.
Any other questions? Huh? Where are you going? No, you can't go out and get it.
Good.
Is that it, guys?
Wish.
Do you think we covered everything?